you and your communities as well. And what's striking to me about this data is that it reveals to us that it's not uncommon for young people ages 15 to 19 to feel sad and hopeless and to think about suicide. However, we have hope that it is less common for youth to act on their thoughts and attempts. Also, what's concerning to me as an advocate is that we are seeing an increase in the feelings of sadness and hopelessness and the thoughts of suicide and having a suicide plan. So clearly it presents an opportunity for us as a community to make sure that we are creating comprehensive plans to address the problem of depression and suicide in our communities. So if you were on the first webinar, I had this slide because I think it's important for us to understand why it's important for schools to adopt a suicide prevention policy, because suicide is the second leading cause of death for youth. We know there's lots of research that documents how students' mental health affects their academic performance. We also know that schools have a responsibility to protect the safety of the children while they're in the school's care. And fortunately, suicide prevention is very consistent with many other efforts that schools already have in place to protect student safety. Many of the activities to prevent violence or bullying and the abuse of alcohol and other drugs may also reduce suicide risk among students. We know that these programs improve school climate and promote connectedness, which is a protective factor to helping to reduce the risk of suicide. I also would like to pause for a moment and just review very quickly some common risk factors and protective factors for suicide. So when you're looking at suicide risk factors, there are things such as mental illness, substance abuse, access to firearms, previous suicide attempts, non-suicidal self-injury or self-harm, exposure to friends and family members' suicide, and low self-esteem. Protective factors are those things that reduce the risk of suicide, and they include such things as family and school connectedness, which is a really important component of preventing suicide, that connection to significant caring adults. Also, safe schools is a protective factor, reduced access to firearms, and positive self-esteem. A lot of the information that I will be talking about this morning on the webinar comes from a very comprehensive guide that SAMHSA has available, and it's Preventing Suicide, a High School Toolkit. And in it, SAMHSA says, and I'm going to read this quote because I think that it's important, "It is essential to implement protocols for responding to students at possible risk of suicide before implementing strategies to help identify students at risk of suicide, such as training staff to recognize suicide risk." That is very important for us to understand. This morning we're not going to necessarily talk about the protocols, but I want us to keep in mind that all of the resources and the programs that we'll be talking about this morning, before you implement any of these strategies, you must have protocols to address when students are identified to be at risk of suicide. SAMHSA's toolkit is a great and valuable resource for school districts because it helps schools be able to assess their ability to prevent suicide among students and respond to suicides that may occur. Also, it helps you to understand the strategies that can help a student who is at risk for suicide. It helps in understanding how to respond to the suicide of a student or other members of the school community. It also identifies some very helpful suicide prevention programs and activities that are effective for individual schools and respond to the needs and cultures of each school's students. And then it also provides guidance on how to integrate suicide prevention into activities that fulfill other aspects of the school's mission, such as preventing the abuse of alcohol and other drugs. So how can schools help prevent suicide? There are four major pillars, if you will, when you're looking at a comprehensive suicide prevention plan. As I mentioned a few minutes ago, having protocols for helping students at risk of suicide and having protocols for responding to suicide deaths are really very critical aspects of ensuring that you have these policies and procedures in place. These are two essential components that every school should have in place. And these protocols should be in place regardless of whether or not you're planning to implement any additional suicide prevention activities. And they should be part of, as I mentioned before, a comprehensive school-based suicide prevention program. Your suicide prevention program will be built on a number of complementary strategies. So after you've developed the two protocols, all staff should be engaged in suicide prevention activities, including educating all staff about the importance of suicide prevention and training all staff to recognize suicide risk. Also training selected staff to assess and refer students at risk of suicide to appropriate services. And these select staff may be your school counselors, social workers, psychologists, and school nurses. So after implementing your protocols, after training and educating your staff, then a school is ready to implement parent education about behavioral health promotion and suicide risk, as well as educating students about health promotion and suicide prevention. And then some schools are also interested in implementing screening for students at risk of suicide. So today we'll be focusing on the last four. They're highlighted in red. So we're going to talk about components of staff education, student education, parent education, and screening. But again, this is under the assumption that your school has already established protocols for helping students at risk of suicide and responding to suicide death in your school. Another very valuable quote from the Suicide Prevention Resource Center that has a ton of resources available to schools who are interested in learning more about how to implement policies and procedures to respond to students at risk for suicide. And it says, when screening for suicide risk, it is important to have resources and systems in place to connect anyone identified as being at risk to appropriate follow-up care and assistance. Again, just reiterating the importance of having policies and procedures in place to refer individuals who are identified at risk for suicide. So let's talk a little bit about the difference between suicide screening and assessment. So a suicide screening is a procedure in which a standardized tool or instrument is used to identify individuals who may be at risk for suicide. So in 2 weeks, there will be a part 3 to this series with Alyssa's mission and signs of suicide, which is one of a very valuable evidence-based program that includes a screening component to the education. And then suicide assessment is a comprehensive evaluation. So once someone is identified through screening, they can follow up with an assessment, which is more comprehensive. And this is to confirm whether there is truly suicide risk, and then to estimate the immediate danger and decide on a course of action or treatment plan. And suicide assessments are only performed by an individual with clinical expertise. And these can be individuals who've had advanced training within your school system, or it can be individuals that you've partnered with in the community, such as from a local behavioral health hospital, community mental health center, or social worker or psychologist in the community. So when identifying youth at elevated risk for suicide, there are really two mechanisms for doing that. And one is through screening, which is using a standard assessment for identifying those students who might be at risk, or through gatekeeper surveillance. And we're going to talk a lot more about that later in the presentation, where we're talking about some gatekeeper training. But gatekeepers are individuals who are strategically positioned to recognize and refer someone who is at risk for suicide. So gatekeepers can be parents, teachers, coaches, neighbors, police officers, librarians. Anyone in the community can be a gatekeeper. But the key thing about a gatekeeper is they are positioned to recognize and refer someone who is at risk for suicide. These are some common assessment tools. Now, I must say that these tools are only to be used by qualified and trained mental health counselors, social workers, or school nurses, or others who you might partner with outside of the school setting for behavioral health support. And there are a variety of them. I just listed some of the more common ones that have been used in school settings, and those include the Beck Scale for Suicide Ideation, the Suicide Ideation Questionnaire, and there is a the Suicide Ideation Questionnaire Junior, which is for grades 7 through 9, and the Suicide Probability Scale. So these instruments are really easy to administer. They take 5 or 10 minutes. The Beck Scale for Suicide Ideation is web-based, but most of these are paper and pencil, really easy to administer and appropriate for typically middle school through high school. Again, these instruments all come with a cost, and they should only be used for qualified and trained individuals. Some school districts, we work with several local school districts who have developed their own screening tools, not assessment tools, but screening tools. Most often when it comes to the assessment piece, that is reserved for someone with special expertise. In addition, I thought I would highlight some advanced training that's available for individuals who are interested in learning more about conducting suicide risk assessments. There is the Applied Suicide Intervention Skills Training, or ASSIST. I am a trainer for the Assessing and Managing Suicide Risk, or AMSR, which is also part of the Zero Suicide Initiative. And then there's Recognizing and Responding to Suicide Risk, and then QPRT, Suicide Risk Assessment and Risk Management Training Program. We'll talk a little bit about QPRT. That's through the QPR Institute, and we'll talk a little bit about their programs later. But these are resources that are available, trainings that are available obviously at a cost for individuals who are interested in increasing their competency and ability in conducting suicide risk assessments. This is a quote from SAMHSA that I think is important for us to keep in mind. Screening efforts should ideally include related training, education, or outreach before or concurrently with screening campaigns in order to improve screening participation rates and to establish a more robust network of support for youth at elevated risk of suicide. There's also some recommendations for school-based suicide prevention screenings, and I'm not going to really, go through this individually. I just pulled out some key things that we should keep in mind if your school is interested in implementing a screening program, and that includes making sure that the tool is appropriate to your needs of your population, and making sure, again, that there are policies and procedures in place that you are able to refer those individuals who are identified at risk. So we'll talk a little bit about staff education, parent education, and student education. Annual training should be provided as part of the comprehensive suicide prevention plan for school faculty, administrators, office staff, athletic staff, cafeteria staff, I think you get my point, transportation staff, and classroom volunteers. And this training this annual training can actually save lives. It should cover risk and protective factors, as well as the resources that are available within the school district to address when someone is at an elevated risk for suicide, and the protocols and procedures that are in place. And this is part of the overall gatekeeper training. Gatekeepers are trained to reduce a person's risk by talking to them and keep a person at imminent risk of suicide safe until additional help can be found. And gatekeepers are also trained to facilitate referrals and increase the likelihood that a person who is at risk will receive professional help. Parent education is also a very key part of the comprehensive plan for suicide prevention. And I know, like with most programs, sometimes it can be challenging to engage and recruit parents and guardians for suicide prevention events. But a few things I'd like to just highlight for you that are also included as part of SAMHSA's toolkit is that you have to make sure that what you're doing is what parents and guardians need. We have to also make sure that we accommodate language, culture, religion, and economic status in our efforts. And it's not advisable that we use the word suicide in the title of an event, because it can be challenging to get people interested to attend an event when the word suicide is used. So it's important to frame it as part of student wellness or health promotion, or even as part of another wellness event. Alternative framing options could include promoting behavioral health and wellness, or helping support students with the transition from 8th grade to high school, or 12th grade to post-secondary opportunities, or learning how to keep your teenager safe. And then you also have to make sure that you reach parents through other mediums in the community in terms of outreach, so might outreach to places of worship or pediatricians' offices. So those are some things to keep in mind when outreaching and engaging parents. Also, I think I mentioned this, but if not, I'll reiterate it, is that it's important to think of suicide prevention as part of your overall wellness plan and integrate parent education into already existing programs. So student education is a core component of your comprehensive plan, and any type of educational programs around suicide prevention that you choose for students must be developmentally appropriate and student-centered and should be integrated into the curriculum. And K through 12 health classes are a great place to integrate this information. And the content of this curriculum should include the importance of safe and healthy choices and coping strategies, how to recognize risk factors and warning signs of mental disorders and suicide in oneself and others, as well as help-seeking strategies for oneself or others, including how to engage school resources and refer friends or family to help. And so you see this slide has 3 components to it. It has the universal strategies, so having a curricula for all students and providing information about suicide prevention, risk protective factors, etc. You also have skill-building programs for at-risk students or more targeted interventions, so helping students with anger management or grief groups or problem-solving programs that address problems that can lead to suicide, such as depression support groups or anxiety support groups or drug and alcohol programs. And then lastly, you have peer-led programs as another targeted intervention. So engaging student leaders and building leadership skills so that students are empowered to help other students who might be at risk for suicide in the schools. This tool I found while I was doing my research, which I think is really helpful, and I'm not going to spend a lot of time on it, but it is a graphic for you to use to guide how to select a program that's appropriate for your school and your district that meets your needs. And so it highlights some things that you should keep in mind as you are developing a comprehensive suicide prevention plan for your school or district. So you want to select programs that have some sort of evidence base. You also want to look at usability and what type of support the program offers to you and the staff. You want to look at the need of your district and your school, your target population. What does the data say in your community or in your state about risk factors and what things are most impacting the students that you serve in your school or in the district. You also want to see how the program fits with any other current initiatives or wellness programs that you're already doing. Many schools are already including social and emotional programming as a core component of their curriculum. So you want to find a program around suicide prevention that's complementary to what you're already doing. And then also looking at capacity. You want to look at the staffing requirements, how you want to look at how you were able to sustain the program over the long haul, and making sure that you also have buy-in from the district and school leaders. Again, all of this is part of developing your overall comprehensive suicide prevention plan. The next few slides highlight some school-based suicide prevention programs. Now, I'm going to give you a disclaimer. I am not a paid endorsee of any of these programs. I chose these programs based on my familiarity with the programs. There are other great programs that are available, but I wanted to just talk through a few programs, and I think that this diagram is a useful tool for us to talk through some things. So the Connect program. The Connect program is one that I most recently became familiar with. And what I like about the Connect program is that it's a biopsychosocial model. So it is a program that was developed by NAMI New Hampshire, and it is an evidence-based program, and they have a prevention intervention program as well as a postvention training. The website for each of these programs is listed on the slide, so you're able to get some additional information. And so this program targets the community members, and there is a train-the-trainer component, as well as they can come in and do training for your team. And they have special training modules for different professions. So they have a school-based module, but they also have modules for broader community members. And what I like about this program, we're doing some work locally at building a community-wide suicide prevention plan where the school is the center, but we have also these other professions and areas that we also want to target in the community. What I also like about the Connect program is that they offer training on establishing protocols on how to respond to, how to develop a suicide prevention plan and how to respond to individuals who are at risk for suicide, as well as postvention strategies for when there is a death by suicide. The Jason Foundation is a program that I am very familiar with as well. Their programs are free. They have programs for students, for parents, as well as for staff. And their programs are available at no charge on their website. And they talk about how to identify, so look at warning signs and risk factors, and what you do to how to intervene with a student who might be at risk for suicide. And it is a youth program focused on youth. Lifelines is another program. It is a comprehensive program. There is a fee for that program. And what I like about the program is that it includes ways and strategies to interview students for the purpose of assessment and referral. And so it identifies very specific techniques for use with challenging students and parents who might be at risk for suicide. I mentioned that there is a fee for this program. The website is also available for you. It also includes information on how to develop protocols around suicide prevention. QPR, which stands for Question, Persuade, Refer. I have been a certified gatekeeper trainer for the QPR Institute now for, I want to say, 6 or 7 years. What I like about QPR is that it is evidence-based, but it focuses on the chain of survival. So you might notice that QPR is very similar to CPR, and there's a reason for that. Both CPR and QPR are part of what we call the chain of survival. They're part of systems designed to increase the chance of survival in the event of a crisis. And so QPR was built around that chain of survival. So just like CPR is about early recognition and access and early CPR and external defibrillator and early advanced life support, QPR has similar elements to it. So it focuses on early recognition of suicide, so the sooner warning signs are detected and help solve, the better. Early QPR, so asking someone about the presence of suicidal thoughts and feelings opens up the conversation that may lead to a referral for help. Early intervention and referral, and it's talking about referral to local resources or calling 1-800-SUICIDE for evaluation and referral. And then early advanced life support. As with any illnesses, early detection and treatment results in better outcomes. So the Q stands for question, the P stands for persuade, and the R stands for refer. And by doing these 3 simple actions and being taught how to do them effectively, you can be part of that chain of survival to save someone's life. So this QPR has also professional trainings for law enforcement, first responders, and healthcare. They also offer some advanced training on risk assessment. So I am a huge fan of QPR. I think that it is very user-friendly as a gatekeeper training. The website is there for more information, and certainly if, when we open up questions, if you have additional questions, I would be more than happy to answer those for you. On the next page, we have several other programs. We have More Than Sad, which is a program of the American Foundation for Suicide Prevention. I am on the Illinois chapter board of directors for AFSP. Really like the program More Than Sad. It focuses on depression. It's a video-based program that has for students, and there are also additional programs for teachers and for staff and for parents. There's a program that we offer called Talk Saves Lives that's available. AFSP's programs are all available at no charge as well. Sources of Strength is a program that I have not used, I am not trained on, but what I have read about it, I'm very impressed with the program. And so I put it on here because I like it. And I think that it is a good program. It focuses on adult advisors and peer leaders who are trained to, through a series of hope, help, and strength messages via presentations, PSAs, posters, videos, to create a climate of connectedness in a school community and encourage help-seeking behaviors. And I like programs that are peer-led and involve leaders in the school, as well as adult leaders, adult advisors. So I really think that this program has some great value to helping to address risk factors and warning signs and prevention of suicide. And then Suicide Alertness for Everyone, or Safe Talk, is another program that I'm familiar with, and it's a similar gatekeeper training for ages 15 and older. And the goal of the program is to, again, like most of the programs, to recognize and engage persons who might be having thoughts of suicide and connect them with community resources. And then lastly, but certainly not least, is the SOS, or Signs of Suicide program. So in 2 weeks, I encourage all of you to make sure that you are here for part 3, where you'll get an in-depth overview presentation on the Signs of Suicide program. Riveredge Hospital has partnered with Alyssa's Mission, the organization that will be presenting in 2 weeks, to support their efforts in the school. And this is one of those programs that has education for students, for staff and parents, but it also has a screening component, which I think is very valuable. And so once they administer the program to students, they offer a screening instrument, and they utilize that screening instrument to identify any students who might be at risk for suicide. And so I don't want to steal their thunder for next week, in 2 weeks, but I really encourage you all to make sure that you join that presentation to learn about what Alyssa's mission is doing in our community and more information about the Signs of Suicide program. And then I have on this slide, I think this is my next to last slide, some additional resources. You know, we're living in a time where we have to make sure that we are providing help and outreach across different mediums. And so here I've listed, in addition to the crisis text line and the suicide prevention lifeline, I've listed several apps that are free to download. Several of them are SAMHSA apps. The No Bullying app is an app that SAMHSA has available, and that bottom app there is called Suicide Safe. My apologies, the name isn't on there. It's called Suicide Safe, and this is an app. It's not for schools per se, but it's for primary and behavioral health care providers, and I included it here because it includes how to use strategies. It provides concrete strategies for identifying and talking to someone who might be at risk of suicide, and it offers scenarios and tips and conversation starters that provide sample language for talking with individuals who might be at risk for suicide. And so it's easily adaptable and applicable to other settings. The top one that says Not Okay is an app like it identifies Not Okay. It allows students to identify individuals to contact, and they can send, and the student can then send those individuals a text message letting them know that they're not okay. One of the things that's important when you have students who are at risk or anyone who's at risk for suicide is to identify support people. So the Not Okay app as well as the My3 app are two apps. They're not the only ones, but they're two that I like that allow you to create your own support system. And so we use these apps. I've shared these apps with our clinical team here at Riveredge Hospital. As many of you know, we're a behavioral health hospital, and they have had a very positive response for young people who like, who are into tech and like to use apps. So the My3 app allows, and similarly the Not Okay app, allows you to create your support system by identifying contact information of the 3 people that you feel you would like to talk to when you're having thoughts of suicide. The My3 app also allows you to build a safety plan, and that's the picture that you see next to the app. And the safety plan allows you to identify what are your personal warning signs. How do you handle, what are your coping strategies? How do you handle when you start to feel sad or anxious? What are things that you can do? What things distract you when you're having negative feelings? The safety plan would be with that individual, with them, at all times, and can help them, be a good reference to them when they're feeling sad or anxious. And so it allows them to list their warning signs, their coping strategies, their distractions, who's in their network, and it also includes whenever you're dealing with someone who is at risk for suicide, whether the risk is imminent or not, you always provide the suicide prevention lifeline number and the crisis text line and any local crisis phone numbers that you have available in your community. You also let them know to call 911. So I just wanted to add these additional resources on this slide for your reference. That is all that I have. It is about 11:42, so we will open it up for questions. At this time, I do believe that we will have two handouts available as well as a copy of the slides for your reference. My contact information is here. Please feel free to reach out if you have any specific questions or if I can provide any additional information. Thank you all for your time, and now we will open it up for questions.
It looks like we're having a couple people type some questions in, so feel free to put them in there and we will get to them as soon as I can see them. The first one is, what is your opinion on the Columbia suicide screen?
So interestingly enough, I did not include the Columbia suicide screen. I initially had it included. It is a very valuable tool. We use it here at the hospital. It also is probably widely used in behavioral health care and health care. It is a very powerful instrument, very commonly used, so it is definitely a tool that can be available to schools as well.
Great, thank you. Yeah, Mary says it seems like a lot of their schools are using it.
Yeah, like I said, I had it on there and then I took it off. So probably next time I'll probably just add it back in there. But yes, a lot of schools do use it. It's very widely used.
And there's a couple more people typing.
Okay.
Okay, Sandy said, do you recommend introducing the apps accessing the text line or lifelines during a health class in 8th to 10th grade? If so, would a parent form be sent with info to the parent, or is parent permission required?
You know, I would, my quick answer regarding parent permission being required would be no. However, I would suggest and strongly encourage that you talk to your building administrator, your district administrators about, you know, including that information as part of an overall plan. However, the apps and the text line and the lifeline, you can get those cards and they can be given out at back to school days or you know, parent-teacher conferences. Those resources can be standalone resources that are available, but I would also make sure that we are thinking bigger in terms of having it be a part of a comprehensive suicide plan. So yes, you can always use the app. It's kind of like, and the crisis lines, I kind of think of it as like telling folks if they're having, you know, in crisis to call 911. So if you're having a mental health crisis, you know, call the crisis text and the suicide lifeline. I do think that that should be something that we are talking about constantly in schools. The apps also, and you know, you can go get so far into the apps. There are lots of like mindfulness apps. There are educational apps that have been created for you know, helping with kids who are feeling anxious or, you know, giving them strategies and things like that. So I think using apps is really can be a really useful tool. But again, I would encourage you to check with your school administrators about that, the apps in particular.
Great. We have a couple more questions. One is from Susan, who says that she's a school architect, and how can building design help with suicide prevention?
I'm not sure the question. If you can clarify, Susan, a little bit. Are you talking about the physical design? I'm sorry, I'm not sure. Physical design of the building?
Okay, Susan is typing in. The next question that someone asked was, are the other resources such as signs of suicide free?
So they are not. So I'm More Than Sad is free through AFSP. The Jason Foundation is free. QPR is offered at no charge. I believe that there is a cost associated with signs of suicide. But again, join the webinar in 2 weeks, and all of that information about their program will be provided. All of the other programs, minus AFSP and Jason Foundation, do have a cost associated with it. As a QPR trainer, once I am trained, I offer the program at no charge. So if you would want to become a trainer, there's a cost associated with it, but if you are interested in having training, there is no cost associated with the QPR training. I do want to get back to Susan's question, the physical environment.
Yes. Susan just said, yes, the physical environment, a special feature or space to help with certain programs may be preferred or required in the design.
You know, interesting that you asked that question, because I think one of the areas, and I'm not an expert in physical design, so I'm not an architect like you, Susan. So, but I think that where some schools struggle is they struggle with space, and they struggle with supportive space. So sometimes, teachers and staff in schools don't have we call it here at the hospital, a calming room. A space where students who might be having a bad day or might be struggling, where they can go and there are resources in there to help them, like music, or the walls are painted, blue with clouds, where they have some chairs and other safe items, available to them to soothe them during, times when they are struggling. I don't know if that specifically answers your question, because I know that just like with hospitals, schools are bound by safety measures and making sure that, school environment and the physical environment is safe. But I think that if more schools had access to space and resources for students to be able to de-escalate and to recharge, so I don't know what that would be called, but that would be something that I think that would be good. It's one of the things that when we go into schools, we talk to schools about having a safe space for students. Like a sensory room with safe materials, Ashley, absolutely.
Perfect.
That would be a great option for schools. I know schools would love that. Stephanie, I don't want to miss your question. As a QPR trainer, there are QPR booklets, yes, for participants. A trainer could cover these costs personally or by their organization, or they can be passed on to the participants. Yes, they are QPR booklets for the participants, and, a lot of trainers that I know locally are part of organizations that do cover the cost for those booklets. And you're right, they could be passed on participants. I am best familiar with Hope Squad. It is, they are affiliated and associated with a partnership with the QPR Institute.
Great.
Are there any other questions?
It doesn't look like we have any more questions coming in. Again, fantastic information, and we really appreciate you spending your time with us, as well as all the participants. We hope that you are learning as much as we are, and that everyone will be signed up for the third and final webinar, which is on July 25th.
Great. Well, thank you, Anne,